15 dangerous diabetes nighttime signs you should know. Diabetes presents 15 silent warning signs at night that everyone should stay alert to. Sleep is more than just a time for rest. It serves as a reflection of your overall well-being. Unusual nighttime symptoms are your body's way of revealing underlying health concerns. Did you know that diabetes doesn't make its presence known loudly? It operates like an underground stream, silently moving beneath the surface of your body. Those nighttime signs are the first ripples hinting at trouble before the flow turns into a raging flood. In this video, we'll expose the 15 subtle signs that appear at night, indicating that something may be wrong, with diabetes as the likely cause. Stay with us until the end to recognize all the symptoms and gain useful tips to transform the way you manage diabetes. Let's jump in. Number 1. Night sweats, a silent storm signaling hidden issues. When you sleep, your body is meant to be in a state of relaxation and self-regulation. However, if you find yourself waking up drenched in sweat, it's not just a random occurrence. It could be a sign that your blood sugar levels are dropping too low. In response, your body releases adrenaline to raise blood sugar levels. This reaction increases heart rate and activates sweat glands, leading to excessive sweating. Additionally, this could be linked to nerve complications caused by diabetes. If the nerves that regulate sweat glands are damaged, they may malfunction, leading to irregular sweating patterns. If night sweats are a recurring issue, start by identifying possible triggers. First, monitor your blood sugar levels before going to bed. Research indicates that stable nighttime blood sugar levels should range between 90 and 130 milligrams per deciliters. Second, consider adding a light bedtime snack that includes low glycemic foods. For example, a slice of whole grain bread with a small amount of peanut butter. Also, maintain an optimal sleeping environment by keeping room temperatures between 64 to 70 degrees Fahrenheit, 18 to 21 degrees Celsius, to reduce excessive body temperature regulation. Finally, if this issue continues, consult a healthcare professional. A doctor may suggest an HbA1c test to assess your average blood sugar levels over 3 months, or check for nerve damage associated with diabetes. Number 2. Leg cramps, a sudden jolt interrupting sleep. These painful spasms can often be traced to an imbalance in electrolytes, specifically deficiencies in essential minerals like potassium, magnesium, or calcium, nutrients that diabetes can deplete. Another major cause is peripheral neuropathy, a common complication of diabetes. When leg nerves are damaged, they may send incorrect signals to muscles, causing involuntary cramping. This not only leads to discomfort, but also severely disrupts sleep. Additionally, poor circulation, a common issue in individuals with diabetes, can contribute to leg cramps. If arteries struggle to deliver sufficient oxygen-rich blood to the legs, muscles may respond with intense contractions, particularly at night when the body is at rest. To reduce leg cramps, ensure your diet includes enough essential minerals. Increase potassium intake by consuming bananas, avocados, or sweet potatoes, and boost magnesium levels with foods like nuts, leafy greens, and whole grains. Stretching your calves before bed can also help improve circulation. A simple exercise involves standing about 1 foot, 30 centimeters, from a wall, placing your hands on it, and leaning forward to stretch your calf muscles. If leg cramps become frequent, check your blood sugar levels and consult a doctor to evaluate nerve or vascular health. Number 3. Restless leg syndrome, RLS, the involuntary nighttime dance. This condition triggers an overwhelming urge to move your legs, especially in the evening or at night. Studies indicate that RLS is strongly linked to peripheral neuropathy, a complication often seen in diabetes. When leg nerves sustain damage, they can produce abnormal sensations like tingling, prickling, or an uncontrollable urge to move. This results in discomfort and severely affects sleep quality, trapping individuals in a cycle of exhaustion. Additionally, RLS is associated with disruptions in dopamine, a brain chemical responsible for regulating muscle movement. Since diabetes impacts metabolic functions, it can indirectly interfere with dopamine production and usage. If you frequently experience these sensations, start by making simple lifestyle changes. Engage in light physical activities like walking or stretching before bed to relieve nerve tension and enhance circulation. Increase your intake of iron and magnesium, as deficiencies in these minerals are commonly linked to RLS. Foods like oats, cashews, and leafy greens are great choices to help manage this condition. Also, avoid stimulants such as caffeine or nicotine in the evening, as they can worsen restlessness. Number 4, sleep apnea, the interruption of life's breath. Sleep apnea is more than just snoring or short pauses in breathing. It's a condition where airflow to the lungs is temporarily blocked, leading to oxygen deprivation. For individuals with diabetes or those at risk, sleep apnea is not an isolated issue. It directly impacts overall health. When oxygen levels drop, the brain sends emergency signals to awaken the body and restore breathing. These repeated sleep interruptions make it difficult to maintain stable blood sugar levels. Additionally, sleep apnea is linked to increased insulin resistance, making diabetes harder to control. This condition can also place significant strain on the cardiovascular system, increasing the likelihood of high blood pressure and life-threatening events like strokes. For individuals managing diabetes, this dangerous combination adds another layer of complexity to disease management. So, what can be done? First, pay attention to signs of sleep apnea, such as loud snoring, sudden awakenings, or gasping for air during sleep. Making lifestyle changes is also essential. Losing excess weight can reduce fat deposits around the neck, which may compress the airway. Additionally, avoiding alcohol or sedatives before bed can help, as these substances relax the airway muscles too much, increasing the risk of airway obstruction. Number 5, frequent nighttime urination, nocturia, the endless trips to the bathroom. This shouldn't be a mere coincidence. When blood sugar levels spike, the kidneys must exert extra effort to filter out excess glucose through urine. As a result, this leads to more frequent urination, even during the night. This not only leaves you feeling drained, but also increases the risk of dehydration and electrolyte imbalances. Additionally, nocturia may be linked to other health issues, such as kidney dysfunction, which is a frequent complication of diabetes. When kidney function deteriorates, the ability to concentrate urine diminishes, leading to increased trips to the bathroom. The ultimate outcome is a disrupted sleep cycle, causing long-term sleep deprivation that negatively impacts both overall health and blood sugar management. To reduce nocturia, regulate your fluid intake in the evening. Prioritize drinking more water throughout the day and cut back on consumption 2 to 3 hours before bedtime to ease bladder pressure. Also, steer clear of caffeine and alcohol in the evening, as they have diuretic effects that can aggravate nocturia. If symptoms persist or worsen, consult a doctor to assess kidney health or evaluate bladder function to pinpoint the root cause. 6. Excessive thirst, an unrelenting urge. Thirst is the body's natural signal that it requires more water to maintain hydration. However, if you constantly feel thirsty, especially at night, it may indicate elevated blood sugar levels. When the kidneys continuously filter excess glucose from the blood, this process leads to frequent urination, as mentioned earlier, and results in rapid fluid loss, triggering unquenchable thirst. If left unchecked, excessive thirst can disrupt electrolyte balance and intensify other symptoms. Furthermore, it may signal chronic dehydration or even the onset of type 2 diabetes. The body's effort to regulate blood sugar and hydration can place immense strain on the kidneys and circulatory system if prolonged. To maintain proper hydration, ensure you drink water consistently throughout the day, rather than consuming large amounts all at once. Spreading out your fluid intake helps maintain stability. If excessive thirst is accompanied by dry mouth, fatigue, or frequent urination, seek medical advice to adjust your diet, medications, or lifestyle to manage the condition effectively. 7. Pain or numbness in the legs, peripheral neuropathy, and invisible electric shock. Experiencing pain or numbness in the legs, especially sensations like tingling, burning, or loss of feeling, is not random. It could be a symptom of peripheral neuropathy, a prevalent complication in individuals with diabetes. When blood sugar levels stay high for extended periods, excess glucose damages the peripheral nerves, particularly in the legs and feet, disrupting normal nerve function. These symptoms tend to worsen at night when the body is at rest, yet the nerves continue sending abnormal signals. A loss of sensation in the legs increases the risk of unnoticed injuries or infections, which can lead to severe complications such as foot ulcers or, in extreme cases, amputation. Additionally, leg pain and numbness interfere with sleep quality. To counter this, focus on staying active. Engage in low-impact exercises like walking or yoga to promote blood circulation to the limbs. Foot care is equally important. Inspect your feet daily for early signs of blisters, cuts, or infections. Wear comfortable, well-fitted shoes to protect your feet from potential injuries. 8. Nighttime hypoglycemia, the stealthy intruder of the night. This occurs when blood sugar levels drop too low during sleep. When this happens, the body triggers a defense mechanism by releasing adrenaline and other hormones, which can cause symptoms like sweating, a rapid heartbeat, trembling, or even waking up in a state of panic. If not addressed in time, nighttime hypoglycemia can lead to serious consequences, including seizures, loss of consciousness, or, in rare cases, a coma. To prevent this, regularly monitor and log your blood sugar levels before bedtime. Ensure that your levels remain within a safe range, 90 to 130 milligrams per DLS. If your blood sugar is on the lower side, consider consuming a small snack that includes protein or complex carbohydrates, such as a slice of whole grain bread with cheese, to help maintain stable levels overnight. Additionally, review and adjust your insulin dose or diabetes medication as necessary under medical supervision, as an excessive dose could trigger nocturnal hypoglycemia. Using a continuous glucose monitor, CGM, can also be highly beneficial. This device provides real-time tracking of blood sugar levels and can issue alerts if they drop to dangerously low levels, allowing for immediate corrective action. Mover 9. Insomnia, the relentless battle against the night. Insomnia isn't just about tossing and turning all night. One of the primary causes is blood sugar fluctuations. When blood sugar rises too high or drops too low during sleep, the body responds by releasing stress hormones like adrenaline, making you more alert and preventing restful sleep. Additionally, insomnia is closely tied to insulin resistance. Frequent sleep disruptions lead to an increase in cortisol production, a hormone that elevates blood sugar and diminishes insulin effectiveness. This creates a dangerous cycle where poor sleep worsens diabetes control, and uncontrolled diabetes further disrupts sleep. To enhance sleep quality, establish a consistent sleep schedule. Going to bed and waking up at the same time daily helps regulate your body's internal clock. Also, monitor your blood sugar before bedtime to ensure it remains within a stable range. A small bedtime snack containing complex carbohydrates, such as whole grains or chia seeds, can help keep blood sugar levels steady overnight. Moreover, avoid screens and electronic devices at least an hour before sleeping. If insomnia continues, consider seeking professional advice. Sleep tests, melatonin supplementation, or lifestyle modifications may be necessary. Number 10, acid reflux, the smoldering fire of the night. Gastroesophageal reflux disease occurs when stomach acid travels back into the esophagus, leading to a burning sensation in the chest and discomfort, especially at night. For people with diabetes, one of the primary causes of reflux is autonomic neuropathy, a condition that affects nerve function. This complication slows the stomach's ability to contract and empty properly, causing food to linger for extended periods. Increased pressure on the lower esophageal sphincter, LES, results in acid reflux. Additionally, disrupted digestion affects sugar absorption and diabetes medication effectiveness, further increasing blood sugar fluctuations. To manage acid reflux, adjust your diet. Avoid trigger foods such as spicy meals, fatty foods, caffeine, alcohol, and chocolate, particularly in the evening. Instead, choose lighter, fiber-rich meals and finish eating at least 2 to 3 hours before bedtime. When sleeping, elevate the head of your bed by 15 to 20 centimeters or sleep on your left side to minimize reflux, as this position aligns better with stomach and esophageal anatomy. Maintaining a healthy weight is also essential, as excess weight increases pressure on the LES. If symptoms persist, a doctor may recommend proton pump inhibitors, PPIs, or further gastric function tests. Number 11, nightmares or vivid dreams, the mind's midnight horror movies. Experiencing intense nightmares or vivid dreams that wake you suddenly? This can be a sign of blood sugar instability. When blood sugar drops too low or spikes too high during sleep, the brain becomes overstimulated, putting the body into a state of distress. As a result, dreams become highly dramatic, featuring scenarios of danger, fear, or running away. Additionally, vivid dreams may indicate an underlying sleep disorder related to diabetes, such as sleep apnea, which deprives the brain of oxygen and triggers stress responses. To minimize this, develop a relaxing bedtime routine. Activities such as reading, meditation, or listening to soothing music help calm the brain and prepare it for deep sleep. Also, reduce your intake of stimulants like caffeine and alcohol in the evening. If nightmares persist or worsen, seek medical advice. A doctor may recommend sleep studies or evaluate your diabetes medications for necessary adjustments. Number 12, high blood pressure at night, the silent nighttime thief. During sleep, blood pressure should naturally decrease to allow the body to recover. However, if it remains elevated or increases overnight, it signals a disruption in the body's regulatory mechanisms. In individuals with diabetes, autonomic nervous system dysfunction is a major contributing factor. This system controls vital functions such as heart rate and blood pressure. Additionally, nighttime blood pressure spikes may result from surges in stress hormones like adrenaline, which occur in response to low blood sugar, hypoglycemia, or sudden glucose fluctuations. These unstable blood pressure levels put excessive strain on the cardiovascular system, increasing the risk of heart disease, stroke, and kidney failure, especially in those managing diabetes. To counteract this, monitor your nighttime blood pressure if you suspect issues. Using an automatic blood pressure monitor that records nighttime readings can help track fluctuations accurately. Reduce sodium intake and avoid processed or salty foods at dinner, as they contribute to hypertension. Additionally, steer clear of stimulants such as caffeine or nicotine before bedtime, as they elevate blood pressure and heart rate. Number 13, palpitations, the unusual nighttime drumbeat. Experiencing a racing, pounding, or irregular heartbeat at night can be alarming. For individuals with diabetes or those at risk, palpitations are not always due to stress or fatigue. They may be linked to blood sugar imbalances or cardiovascular issues. Furthermore, palpitations can signal an electrolyte imbalance, a condition commonly seen in those with diabetes. An imbalance in essential minerals like potassium, sodium, or magnesium can disrupt the heart's rhythm, leading to an irregular heartbeat or palpitations. Additionally, nighttime palpitations may indicate underlying issues such as high blood pressure or cardiovascular disease, both of which are common complications associated with diabetes. To reduce and manage palpitations, start by checking your blood sugar levels before bedtime to ensure they remain within a stable range. If blood sugar levels are low, consuming a light snack containing protein or complex carbohydrates, such as a slice of whole grain bread with peanut butter, can help maintain stability overnight. Also, increasing your intake of essential minerals like potassium and magnesium through diet can be beneficial. Foods such as bananas, almonds, and leafy greens not only support heart health, but also help restore electrolyte balance. Number 14, teeth grinding, the nocturnal squeaking sound. Teeth grinding, also known as bruxism, frequently occurs during sleep and can result in waking up with jaw pain, headaches, or overall fatigue. One primary cause of bruxism is blood sugar imbalance. When blood sugar drops too low at night, the body initiates a stress response, releasing adrenaline, which increases muscle tension and leads to involuntary teeth grinding. Additionally, bruxism may be linked to autonomic neuropathy, a common diabetes-related complication that heightens sensitivity in the jaw muscles, causing excessive tightening during sleep. To help minimize this issue, developing a relaxation routine before bedtime can be beneficial. Techniques such as deep breathing exercises, meditation, or applying a warm compress to the jaw can relax the muscles and reduce grinding. Furthermore, maintaining good oral health is essential. Using a night guard can cushion the teeth and jaw, preventing excessive strain and potential long-term damage. Number 15, morning headaches, the painful awakening. When blood sugar drops too low overnight, the brain lacks an adequate energy supply, which can lead to morning headaches. These headaches are often accompanied by additional symptoms such as fatigue, sweating, or shakiness. Moreover, morning headaches can be linked to sleep apnea, a sleep disorder commonly found in people with diabetes. When airflow is restricted, oxygen supply to the brain decreases, resulting in headaches and morning fatigue. Another common cause of early morning headaches in individuals with diabetes is dehydration or electrolyte imbalance, which frequently occurs due to increased nighttime urination. To minimize the risk of morning headaches, optimize your sleeping environment to reduce sleep apnea symptoms. Keep your bedroom cool, quiet, and comfortable, and avoid stimulants such as alcohol or sedatives before bed. Additionally, stay hydrated throughout the day while limiting excessive fluid intake in the evening to prevent dehydration. If electrolyte imbalances are a recurring issue, incorporate potassium and magnesium rich foods such as bananas or leafy greens into your diet to help restore balance.